usually get is, how often should I be injecting my testosterone prescription? A lot of patients that are new to my clinic maybe have been receiving testosterone therapy from another clinic, maybe a male hormone clinic, maybe their urologist or to primary care was previously prescribing them testosterone, are used to receiving testosterone injections weekly. And when they come to my practice, I usually will direct them different. And a lot of patients started asking me, well, why? Why are you doing it differently? That's what we're going to talk about today. Welcome to this channel. If you are new here, don't forget to subscribe, hit that notification bell, and also join my VIP free school group. This is where I get to talk about secret things that I cannot talk about here on YouTube, okay? You don't want to miss it. We talk about real spicy topics in there, okay? Join the VIP group. A lot of patients ask me, Doctor, what is the real or the proper way to inject testosterone? Let's say you are a patient that we've tested, confirmed that your testosterone is truly low and it needs to be optimized. Okay, meaning that you have reached that age that we call andropause and your testosterone level is lower than it should be for your age. And you're having symptoms like fatigue, belly fat, no motivation, delayed recovery from exercise, night sweats, trouble building muscle, feeling super sore for so long after working out. Those are some signs that's telling us that yes, your testosterone might be low, and we've tested, we've confirmed, repeated the test, and confirmed that it is not a central brain problem, it's not a pituitary tumor, this is low testosterone due to age. We've now decided to replace it, and we've talked about all the different options that are available, and we've settled on using injectable testosterone. Whether it's because it's the option that your insurance covers, or maybe based on your schedule, this is the best bet, or maybe it's something that's worked for you in the past and you would like to continue that, right? So let's talk about what is the proper dosing schedule, okay? One of the things I'm going to definitely point out here is that this once a week testosterone injection is not really physiologic, right? When I say physiologic, what I mean is natural, what your body would naturally have done. Because normally, remember, when we talked about the natural feedback loop of the brain talking to your testes, releasing FSH and LH, which are follicle stimulating hormone and luteinizing hormone, those hormones are released on a daily basis, and your testes was releasing testosterone on a daily basis, on an as needed basis. So whenever the brain will sense that there's not enough testosterone, free testosterone floating in the bloodstream, it would release this hormone so that the signal, these chemical messengers can go to your testes, tell the testes to please make some testosterone for the day, we need some for exercise, we need some to manage the project, or just be motivated and not depressed, or whatever the case may be. We make this testosterone from the testes and it goes circulating in the blood to do all these things that it's supposed to do. But when we get to the andropause, where we're not making enough anymore from our own testes, what needs to happen? Well, we now decided to inject testosterone, but how often should we be injecting it? Most patients don't want to inject every day, no matter how, painless it might be, right? You just rather not. This is an intramuscular injection, so it uses a pretty, decent sized needle to get this thick testosterone oil into your body, right? So you might not feel like you want to do something like that every day. And also because of schedule, a lot of men that don't like to inject themselves go to a clinic. They will come in, have the nurse inject them, or some patients go to like a urologist or their primary care doctor, or their spouse has to inject them. So to kind of make it convenient, we came up with this 1 week just inject it once a week and let your body deal with the consequences, okay? Well, the consequences are not great, let me tell you. Okay, so when you inject testosterone once a week, the chances are that we've given you a bolus of hormones that your body is supposed to use over a period of a week, but we've given it to you in one day. So what happens is you go through what we call the roller coasters of testosterone replacement, because when we give you that bolus, man, boy, do you feel great, right? That first couple of days, maybe 3 days, because there's more hormones in your bloodstream than you really need for those days. So your body has to decide what to do with the excess. Well, the excess that it has during those first few days, for a lot of men, their body starts to convert some of that to estrogen, what we call aromatize, right? It starts to aromatize it into the female hormone known as estrogen. And what happens with that is that your body now has to deal with that, right? There's only so much estrogen that you should have as a male. And once you have this weekly boluses of testosterone that your body is not consuming right away, you're now having all this extra estrogen being made that you don't necessarily need. And what can happen downstream is that you might start developing what we call gynecomastia, or easily known as the male breast, because that excess estrogen that your body is making from that excess testosterone is now causing this issue. Not only that, we find that your blood starts to thicken, okay, because testosterone, believe it or not, actually encourages your body to make red blood cells. And when you're now getting boluses on a weekly basis of testosterone once a week, well, during that high spike, the body gets the signal for it to go make some extra red blood cells. So now you're getting a lot of red blood cells being made during those times. And this can actually, for some men, cause too much what we call erythropoiesis, which means that now you have too much red blood cells floating around, which is thickening your blood. So the solution to that is, well, we just tell you go donate blood, save some lives, and that solves it. We like the idea of saving lives and donating blood, but we also don't want the risk of your blood getting too thick and potentially putting you at risk for a stroke. So why not dose the testosterone in a way that that doesn't happen? Why not try to dose it in a way that will mimic a little bit more of the way the body does it, or at least get as close to it as we can? So most of my patients know that I recommend that we don't inject weekly. Maybe bi-weekly if you're really, needle adverse, I guess. You don't want to have to inject so often. So let's say we do it twice a week. It's still not ideal because every day will be better, but it's a little bit better than that one-time bolus, because now we split that bolus into two. So we do one early in the week and one later in the week. So now instead of having a roller coaster that looks like up to the cliff and down, right? Up to the mountain and down, now you're having, well, a little bolus that doesn't really get to peak too much, and as that's dwindling, we get another bolus and we do that, right? So a little bit closer to normal, but it's the best that we can do. So you don't have to come to the clinic multiple times. We usually will educate you on how to inject this at home with maybe a needle that's not so big or less painful, and just do it twice weekly. But if we could do it every day, that would be super, right? Because now we are giving smaller doses throughout the week, kind of like the way your own body would have given you daily doses. And that is when we really see very little issue with the aromatization we see a little bit less problems with blood getting too thick, because now we're not giving those boluses that's just hanging around and doing other things that we don't typically need. So the answer to the question is, how often should I be injecting my testosterone? If you can't do it, daily is better. If you cannot do daily, twice a week will be the next best. And if you're absolutely scared to death of needles, I guess once a week would have to do. But we have to watch out for those downstream effects by measuring the blood and seeing what's happening. Okay, so let's say you're the patient that's been doing once a week injection, and now what? And you want to keep doing once a week injection. Well, you're probably going to be prescribed a prescription that's called an estrogen blocker. Most of the time we use something called anastrozole, which is a estrogen blocker that you would take once a week. Sometimes we can prescribe it daily, depending on the dosage. We would try to use that to help block your body from making that excess estrogen. Some patients can do it naturally by using a supplement called DIM, D-I-M. And don't let me try to butcher the name of this supplement because it is a long one. But you can type DIM supplement and you go ahead and read what it says, okay? Alright, so DIM can help you with blocking estrogen naturally. And it is a substance that we actually find in cruciferous vegetables. So things like broccoli, bok choy, cabbage, Brussels sprouts, right? Those foods are high in DIM. But most of us will have to eat a whole lot of it every single day to be able to get the number of milligrams that we need to really do the trick. So most patients are buying supplements of DIM anywhere from 150 milligrams to 400 milligrams. And that will be helpful in helping to block estrogen naturally, right? But if your doctor is not prescribing an estrogen blocker, make sure they're at least watching what your estrogen levels are showing every time you go for your follow-up. So it is important. We can't just keep prescribing testosterone and not measuring. We need to measure because we don't want you to develop gynecomastia. It's hard to reverse that. Okay, so it's the best thing to do is prevent. And we prevent it by spreading your doses out, using the normal amount that just needs to bring you to physiologic level, not Superman levels, okay? Physiologic levels, and using natural things like DIM to block that estrogen production. Also, making sure you're not drinking too much alcohol and things that stops your liver from processing the testosterone properly also is very important. Hope that helps you. If you have any questions about this, please leave your questions in the comment section below so I can address it either on a new video or depending on what type of question I might just be able to answer in the question section. Thank you and catch you on the next one.